Antibiotic resistance, the hidden threat to global health. On today's episode on Health Insights, we are joined by Dr. Lennox Kajingwe, a renowned healthcare provider. Listen in as we discuss the cause, consequences, and solutions to this pressuring issue. Don't miss this vital conversation. Stay tuned. Welcome to the show, Mr. Kajingwe. Can you start by telling us more about yourself and also what actually inspired you to focus on this particular issue about antibiotics?
All right, thanks for the question. First of all, I would start by introducing myself. I am Lennox Kajingwe, as you have said, and I am a registered nurse and midwife by profession. Yeah.
Telling about these antibiotics and also antimicrobials, can you briefly tell us what these two or what do they mean and how do they differ?
All right. Thanks for the question. First of all, I will talk about antimicrobials. So when we talk about antimicrobials, we are looking at an umbrella of these small organisms that cause infection to human beings, or I should say that cause diseases to human beings. So these microbes have been classified into different classes. We are talking about bacteria, we are talking about fungi, we are talking about viruses, we are talking about the parasites. So these microbes, to be dealt with, or for somebody to get rid of these microbes in their body, that's when the antimicrobials alive. So antimicrobial, it's a term that is used to describe different types of medications that get rid of different types of microorganisms in the human body. So these organisms, as I've already said, that we have bacteria, we have viruses, we have fungi, and we have the parasites. So we are isolating one type of class, which is the bacteria. So these bacteria, they are having the type of medications that is being used to treat them or to get rid of. Now it's the antibiotics.
This whole thing is just confusing. Can you at least try to break it in simple terms so as me and also our listeners can easily understand what actually you're talking about?
All right. So what my emphasis is on in these two different terms, the antimicrobes and the antibiotics. So antimicrobes, we are talking about an umbrella, which we are talking about a lot of microorganisms. Now antibiotics, we are talking about one specific organism, which is a bacteria. Yeah. So anti means against. So these are medications that we are using to treat bacteria.
What are the main use of antibiotics in medicine?
All right. In medicine, there are a lot of uses for antibiotics, but my main emphasis will be on two uses, which are the common ones. So the first one is we use antibiotics to treat bacterial infections. For instance, one has acquired an infection that is caused by bacteria. We are using a certain type of medication to get rid of that infection. Hence, we are treating. And the second use that I've said is the prophylaxis or the prevention of an infection. For example, I would say that one might want to go to theater. So since in theater they will make a cut on the body, bacteria might find that place a suitable environment for their growth. So we want to in order to prevent that, we are using antibiotics. We are giving the patient the antibiotics to prevent the growth of bacteria on that cut, hence preventing. That's prophylaxis. And in prophylaxis, we are also talking about some of the measures that we use. We are using different type of medications. For example, hand washing to prevent the transfer of microorganisms or the transfer of these bacteria from our hands to that patient. So that's preventive as well.
So how best do you protect yourself and even also the patient and associating with my antibiotics? How best do you protect yourself with it, Mr. Balsani, as you are treating the patient?
All right. There have been measures that were put in place by the World Health Organization. So us as health workers, we go through we use those measures that were provided by the World Health Organization. And sometimes the hospital as well might provide a policy to say that these are our policies, we're using these ones to prevent the transfer of infection from one patient to another, and from ourselves to the patient, or from the patient to us as healthcare providers. So we are talking about the hand washing with soap. So soap is an antiseptic, I would say. So it helps to get rid of bacteria as well, that's preventive. We are talking about the prophylactic antibiotics, whereby we're giving an antibiotic to prevent treatment, and the responsible use of the antibiotics as well. It's one of the measures that was put in place by the World Health Organization.
How have antibiotics impacted public health since their discovery?
All right. I would say since the discovery of antibiotics, a lot has changed in healthcare practice. And along these years, we have seen a lot of antibiotics being produced by the pharmaceutical companies. And this has helped both positive and negative. I'd say the discovery of antibiotics in the positive way, it has helped the human being in their growth. For example, it gets rid of infection at early stage, therefore the person gets to live longer than if the infection would have stayed there. So it has helped in our health. As we are today, we have used antibiotics since we are born. Therefore, without those antibiotics, maybe the infection could have ended our lives somewhere else along the way. So they have helped in that. And on the negative side, the discovery of antibiotics has also led to the development of new bacteria that are more harmful than those that were present. For example, the discovery of tuberculosis. The birth of tuberculosis is somehow related to the culture of bacteria, like the growth of bacteria in a laboratory, which was equipped and it was released to the outside world. So it has the birth of antimicrobes has helped other people in the development of more harmful bacteria, or sometimes our body as well has developed other bacteria that are more harmful than those that were present a long time ago.
What about the consequences of misusing or overusing antibiotics?
Let me break that question into two. First, we are talking about the overuse, and we are talking about the misusing. Yeah. So in misusing, it means someone is using the antibiotics wrongly. Mm-hmm. And in overusing, you might be using it correctly, but actually you have used it for a long time. Therefore, the consequences in misusing is the development of bacterial resistance, whereby the bacteria that are developing are being resistant to the current medication, the current antibiotics that we're having.
You have talked about resistance. How common is antibiotic resistance, and also its implication on health?
All right. Actually, that is the main emphasis of this topic. The reason why I chose this topic, it's because of the bacterial resistances that are outside here. Yeah. So I'll go back again to the misuse and the overuse. So in overusing of antibiotics, so the it has been prescribed maybe by a physician or any healthcare provider who prescribes bacterial antibiotics. So hence you have overused them. These antibiotics, since they eliminate bacteria in the body, they also sometimes eliminate other important bacteria, because our body has more bacteria than we think, and not all these bacteria are harmful to the body. Some of them, they help in digestive system. Some of them, they help to get rid of other infections, for example, yeast infection. So once you get rid of these bacteria, the body might develop other bacteria that are harmful to the body after you have stopped using the antibiotics. So that's overuse. Now to talk about the misusing, it means you're using them wrongly. So the misusing might be first the dosage, the frequency, how many times are you taking the drug, and we are talking about treating a right bacterial infection with a right antibiotic. If there is a mismatch in that, it means you're also using it wrongly, misusing. Therefore, these have helped in the development of resistance. Actually, I've seen a lot of the pharmaceuticals has brought a lot of dozens of antibiotics. You see them on the market. You see them in the drugstores. You see them in the hospitals. It's because some of the early antibiotics that were there, they are not working anymore. Now, that's where the resistance is coming from. Because resistance, it means to resist. It means it's not working. You are trying to eliminate them, and they are resisting to say, no, we'll have to stay. Why are you staying? It's because your medication is not working. So, resistance actually has been one of the problems and one of the challenges that has arrived due to the misuse and overuse.
So how can people make a proper use of antibiotics to avoid resistance?
All right. I would say since these resistances are coming because of the misuse and the overuse, correcting that would be the best idea. So we are looking at the use of antibiotics in the right manner. We are looking at having prescriptions that are trustworthy, that have been done by professionals. We are looking at the development of our laboratory system. Since we treat according to, I would say, clinical presentation, how is the patient presenting? So we make assumptions to say, okay, this is caused by this. But if we can develop our laboratory system whereby we culture and then we see which antibiotic is working, it means it will also help in giving the right medication. So we are looking at the laboratory system, the diagnostic system, whereby we have to check what type of antibiotic is suitable for that type of infection. We are looking at the proper use of antibiotics, whereby we have to use them correctly. If they say take them 3 times a day for 7 days, you have to finish them despite that you're feeling okay. And we are also looking at the measures that were being put in place by the World Health Organization.
Also, there are some initiatives that healthcare providers are taking to specifically to get people on the use of antibiotics to avoid resistance. Are there any initiatives?
Yes, more initiatives have been put in place. For example, emphasis has been put on the frequency of the use of antibiotics. You will see posters in the hospitals saying that you have to finish your antibiotics, you have to take them in time, you don't have to miss doses. Yes, we are trying to civic educate the people. So actually that one also helps as a reminder to the healthcare to say that you have to tell the people this type of information. They have to go with this type of information at home when they take antibiotics. And since we are we are getting more literate as well nowadays compared to we are talking about the coming of internet. Yeah, actually we are reading a lot of information there. We can also share through social media and the likes.
So all those initiatives that have been put in place are working?
I would say they are not working because if the resistances are still happening, it means something somewhere is wrong. Yeah, so as I'm saying, if you see that the resistance is still coming, it means something somewhere is wrong. It means we are still continuing our habit of misuse, overuse, and using one type of treatment to treat long infections. So yeah, it's not working.
Okay, so how can an individual use antibiotics responsibly, and what can be the best practice for taking the antibiotics?
All right. I think the best way would be one, the use of correct route in order to access antibiotics. What am I trying to say when I say that? I would say the coming of pharmacies, these drugstores, these private clinics, it's giving a lot of freedom to people. They would go to a drugstore and buy any type of antibiotic without any prescription, and without also any guidance from a physician or a doctor. It's because the way they are feeling, they are trying to relate to what happened in the past. So they are using that information to get another type of medication. Yet they don't have the basis to say actually maybe there's a difference in the type of infection. So one, it's that one that I've said. The other one is if we can get to the right route. Therefore, you have fallen sick, you go to the hospital, they prescribe the antibiotics. Now it's the use. How are you using the antibiotics? So you have to use them as prescribed. To say if they say take them 3 times a day for 5 days, you have to finish the whole course despite that you're feeling okay. Yeah. So the other thing that I can also say is on the overuse. I think healthcare providers should also be alarmed here to say if we're having a lot of resistances, what are things going wrong? Maybe we are the cause. So healthcare providers also have to change their attitude there to say, okay, if we have prescribed this type of drug for this type of for this type of period, let's change it. Maybe it's not working. Let's do some tests.
So the coming in of pharmacies and the like has also contributed to people kuteyaziwiza antibiotics mina kuti sizikugwira since sana kali prescription kuchokera kwa a recommended doctor.
Yes, since there's no evidence to say this type of drug works on this type of treatment. Therefore, they have contributed a lot, I would say. Yeah, since they are selling these drugs without prescription, therefore the person may take the drug anyhow and may stop taking the drug when he feels that I'm okay. Yeah, but then
it's a tendency among us.
Yes, very much. If you feel better, you say actually there's no need for the medication.
Yes, so, I'm done with them.
Yeah, so if you're accessing the medication the easy way, there are no proper restrictions to say no, actually you have to take them this order. They just sell them to you without even telling you the frequency.
Yeah.
Even sometimes they might give you a low dose. Actually, since you just want to buy the medication, they don't know the use of the medication. They would give you even a smaller dose.
Sometimes they give you more just just have to sell.
Yeah, that's where the overuse is coming, because sometimes you might feel like maybe I need to finish all of this for me to get better. Now that's an overuse. So yeah, they have contributed a lot.
What are effective ways to boost your immune system and also prevent infections?
I would say lifestyle is the best. So when we talk about lifestyle, we are looking at a lot of things. We are looking at the food that we eat. Is it nutritious or not? Because some of the vitamins also help in the body to develop our immune system. We are looking at our physical exercise. How is our physical well-being? Yeah, so for a person who does physical exercise, you get rid of a lot of toxins with I would say dead cells, which are some of them are suitable environment for the growth of bacteria. So we're getting rid of those from our body.
Can you elaborate more on this one?
On the physical.
Yes.
All right. I would say, for instance, if you are doing physical exercise, you sweat.
Yeah.
Yeah. You feel like drinking more water. So the water also helps to get rid of other salts in the body that might have been useful for bacteria to grow.
How important is hand hygiene in preventing the spread of antimicrobial resistance infections?
All right. Since most of the times we use our hands to prepare food, we use our hands to eat the food as well. Yeah. So if you are not washing your hands, it means you are taking those bacteria, you are putting them inside your body. Therefore, you are causing more infections to yourself. But then if you wash your hands, let's say with soap, you are trying to get rid of the bacteria that were present in the hands. Actually, our hands touch a lot by the end of the day. We shake hands, we touch surfaces. There are a lot of bacteria growing in different surfaces. So if you wash your hands, it means you have washed away those all types of bacteria that were present. So it helps our body to get less infected. Hence, we need less medication. Hence, less resistance.
Earlier on, you talked about that some antibiotics, not all antibiotics are not bad.
Yeah.
Can you please give us a clear explanation about that?
All right. I say that not all bacteria are harmful to the body. Some of the bacteria are more useful. For instance, in our digestive system, we need different types of bacteria to digest the food, to break it down, because digestion takes a lot. I will not go deep into that since we're talking about the bacteria. So they are useful in the digestive system. For other amino acids to be digested, they need those type of bacteria. And they also prevent the growth of other bacteria. It's like there is a fight to say this is a good bacteria and a bad bacteria. So the good bacteria, they also help to fight other bacteria. So if you get rid of them using the antibiotics, you see the ones that they go against, they are growing. For instance, if you have used antibiotics for a longer time, sometimes you might get a fungal infection, since the bacteria that were present were good to the health of the body. They were fighting other fungal infections. For example, if you take antibiotics for quite a longer time, you might develop a yeast infection in your body, a fungi that grows on the body.
So how does the body manage to balance these antibiotics being good? Some are good and some are harmful to the body.
All right. So the body has its own balances. We call it homeostasis, whereby it regulates the balance of everything, whether it's body temperature, whether it's sweat. So there's also harmony in the type of bacteria that should be present. So it does that naturally. Sometimes, of course, things might happen that some harmful bacteria are growing. It means the good bacteria are losing, but it happens naturally the way God created it.
Can you share us your experience with antibiotics?
I would say we use antibiotics on a daily basis. We have a lot of infections that are happening outside there that we are treating. We have a lot of people going to operations whereby we have to prevent the growth of bacteria. So actually, we use them on daily basis. I would say the experience that I've had for this period that I've been working, now the bacteria not responding to the medications that we're giving. We're talking about the resistance that we're talking. So you give the first line, they don't respond. You give the second line, they don't respond. And we're looking now for alternatives to say, okay, let's go as high as the third line of antibiotics. So, yeah, despite the use, we're having challenges with the responding of the patients to the treatments that we're giving.
What do you think is the most important thing to our listeners to know about your expertise and also experience in the field of antibiotics?
I would say people should get this message to say, one, they don't have to prescribe antibiotics for themselves. They don't have to buy antibiotics anywhere else unless they have a prescription to say this was written by such type of a doctor, and we can trust that because the resistance is getting out of hand. So they have to get that. Aside that, they also have to add the regulations that have been put in place to say you have to follow the prescription. If they say 3 times a day, take them 3 times a day. For 5 days, you have to take them in the same range of time. Yeah, you have to complete the full dose. And the other thing that's more important, it's we call it a review visit, whereby you have been treated and you go to the same doctor or physician to say, actually, I'm here for review. How has the antibiotic worked in my body? If there are tests that have to be run, they have to be taken.
So how often should a person go for review?
All right. Mostly when we prescribe antibiotics, we would say, if you take this for 3 days and you don't see change, come to the hospital.
So there's no specific time
after they're finishing the course of antibiotics, usually you have to come for review. But since our health facilities, mostly we are running short of staff, we just let the people go. Hence, they also health care providers as ourselves, we have to change our attitude to say people should have a return visit.
Thank you so much, Mr. Kajingwe, for sharing your expertise and also your experience.
All right, thank you.